and a very good evening to you. You're watching News9 Digital. I'm Pratibha. Thank you for joining me live. Every day we come to you with updates on coronavirus or anything that might come as good news in the race for the vaccines as well. Now today we're going to talk about a study that says that a drug that has been useful against cats in fighting coronavirus could perhaps have an answer to people as well having coronavirus. Could this drug that has worked against cats provide headway for the vaccine for humans as well against coronavirus? This is a study that has been conducted in Canada, and the researchers there believe that if it has worked in cats, in treating coronavirus in cats, then it could treat humans as well. It could be effective against SARS-CoV-2, which is a virus of the worldwide pandemic, coronavirus as well. So this definitely comes as a welcome surprise on the face of it when you say that it has worked in cats, and there is a probability that it could work on humans. Of course, it just paves the way for human trials to take place. There's no surety, but it comes as a headway in this regard as well. This is the reason why it was seen as a welcome sign. Today in the show, we're going to talk to a veterinarian to find out whether this is true or not. This is going to be a myth buster on whether we should really be celebrating it or still take it with a lot of caution. Now, of course, for the human clinical trials of the drug as well, which is a protease inhibitor called GC376, has it been effective against cats or not? To discuss more on this, we are joined in by Dr. Srikanth. Many thanks for joining us, Doctor. This is something that the people across the world could be celebrating. This is a study that has been conducted in Canada, and of course we don't know the efficacy of it yet because it only paves the way for human trials, but there will be a lot of factors that will be coming in as well. But if you can tell us, how has it worked in cats? Has it helped in eliminating coronavirus completely in cats?
Good evening. I think we don't have any much thing to celebrate right away.
Okay.
Because even in cats, probably the usage is very limited. Coronavirus is every animal or every human being have infected with coronavirus. It's not the COVID-19. The coronavirus is a strain of a virus which is affected to everyone.
Yeah.
So in cat, we do cause a disease called feline infectious peritonitis, or shortly it is called as FIP. Okay, this disease is still not curable and in cats. Even though this new drug, whatever we are seeing is GC374, it's not that high, it doesn't show promising results.
Okay.
The report says that it is very much helpful for cats with less than 13 to 14 weeks of age to probably prevent them from like gastroenteritis, all those symptoms.
Okay.
But FIP also causes other diseases, other symptoms like neurological, but they are not effective against those cats which are showing those symptoms.
Okay.
It's a very preliminary drug. I think there's a lot has to go into it. And as you know, with the present WHO guidelines for usage of any vaccine or a drug, you need trial. Okay, that is what is going on. And the day the COVID struck, probably everyone said the vaccine will be there in 1 month, 2 months. So everyone was claiming it, but still now you know the result.
Yeah.
So WHO expects a trial. A simple logic I tell you is, if at all if the company produces a vaccine and says use it, this is going to prevent it to you. You take it. If there is any reaction, will you keep quiet? Don't you sue the company? So the company wants to be shield-proof before it launches the drug or the vaccine to the country.
True.
And any for usage. So that takes a lot of trial. So there are some vaccines that tried and led to cancer. So all those things are there. So definitely this is a very premature statement to say this GC346 can prevent COVID. It still has to be a lot of work has to be done.
True.
Okay.
Of course, it has to run through human trials, and it's not going to be as easy as well. It's not like if it has worked in cats, it's definitive that it will work in humans as well. Of course, that will be a long way ahead. But this GC376, according to the study, what it says is how it has worked in cats is that it interferes with the virus's ability to replicate, thereby ending the infection. Doctor, if you could tell us a little bit more about the prevalence of coronavirus in cats and whether like you said, it has not been so effective. So there's no definitive information that it could eliminate coronavirus completely in cats.
Yes, 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 sir. So if you want, I can read out a report, the conclusion of the study of a report, what it says. So it will be see, inhibition of 3CL protein of FIPV in GC, with GC375 effective under the condition of this study in decreasing the virus replication and causing remission of disease signs in cats with naturally occurring FIP, outside of the CNS. See, FIP can cause CNS, central nervous system. It can cause any effusions. There are two forms. It's called dry and wet form. So it is only trying to, probably you have some relation in curing in the non-CNS symptoms. The sustained remission in this study were not more apt to occur in kittens less than 18 weeks of age. Okay. Whereas it clearly says it doesn't show slow progression of neurological disease. It does not reverse the condition. So it's still in the cat itself, we are not still sure how far it is going to cure them. The FIP prevalence is a disease is of a very young and very old cat. To be frank, we don't have a foolproof test to prove that this cat is FIP. Though there are a lot of LISR tests, all those things tests, it's very difficult to confirm a test, to say confirmative test which is there. In a test, you have one called sensitivity and specificity, saying positive as positive, negative as negative. So still we are trying to depend on saying negative as negative than saying positive as positive. So there's a lot way to go ahead. Hopefully, if it comes out well, it's happy for the whole world. At least we have a drug to treat corona, COVID-19.
Absolutely.
Hope there's some breakthrough happens, but it needs a lot of trials. It's not easy as we talk about. At the back end, I think the research people, from the day one, it will be burning candles. Nowadays, not the candles, the lights, eyes, everything, to get out a drug so that you can get rid of this pandemic.
Okay, all right. Lastly, doctor, would you say that until an effective vaccine really comes out, this adds to the arsenal of the vaccines, or would you say that it's best to just wait for the traditional methods that we know as of now, and it's better to wait out for that?
See, there is no foolproof medication for any virus aspect. To be frank, vaccine is the best. So prevention is better than cure. So let us use that logic. Unless the vaccine comes out, I think it's very difficult to say we are free of the corona.
True.
Okay, there are a lot of other viruses which come and go. We may not know at all. But even in India, I think more are asymptomatic. See, one WHO report said asymptomatic people will not spread the virus. Recently in the paper, there's a report saying asymptomatic spreads more virus. So it's very difficult. They're still studying what is virus is.
True.
So it's still difficult to pinpoint and say that we can kill. And as long as I heard the treatment regime is very simple, keep it very simple. Give a dexamethasone, prednisolone, and aspirin to treat. They're trying that. Your remdesivir, everything is used only when people in advanced state. I think it's
best to wait for the vaccine to come out. Any celebration as of now with any study coming in would be too premature.
Bill Gates has told that by 2022, when the whole world, if the whole world gets along together, then only we can able to contain the pandemic. I think 3 days back in Times of India, there was a big article of Bill Gates' speech. I think
that's true. That we need to be together in this, and that's the best way to defeat it. It might be tough times, but of course, in such times, we can still rise above it with humanity. Many thanks, Dr. Srikanth, for joining us live with your expertise on the subject. Of course, even though on the surface it seems like good news because it is a drug that has been effective in treating coronavirus in cats, the doctor telling us that it has not been completely effective. So even in cats, because of various factors, it has not been completely effective, which means that there are going to be more factors when it comes to human beings as well. So it's going to be a long way. Yes, it might be a little something to hold on to, something that the researchers can look at on whether this can work on humans or not, but it's going to be a long way. There are several other vaccines as well that are already in phase 3 of the human trials, so it would be better to pin the hopes on those vaccines. Thank you so much for watching this video. Please let me know in the comments as well of what you thought of it, and stay home as much as you can. Thank you so much for watching. Take care.